You are listening to the Stave Off Podcast, the podcast that gives you the information you need to stave off illness and injuries, letting you live a happy life. And now your hosts, Nick and Christina.
Hi everyone, and welcome to the Stave Off Podcast. My name's Christina Novak. I'm a registered physiotherapist and one of the co-owners of Stave Off Physiotherapy and Exercise Facility. I want to apologize in advance if I sound a little nasally. Nick and I have been, seems like bouncing this cold back and forth between each other over the last couple of weeks. And as much as we try and kick it, we're still kind of under the weather. So he is down and out, and I'm going to be the one looking over the podcast for the next couple of episodes. Hopefully I can rope him back in the next little while. But today's episode, we are going to be talking a lot about diabetes. And as I was getting ready for this podcast, I thought it was so interesting because I started to look at the statistics and go over some of the prevalence rates and some of the complications. And it really can be extremely eye-opening because we think about diabetes as one person in our family, but it really does affect so many different people. So I'm going to try and go through a little bit of the statistics and then kind of talk about what happens with diabetes, focus on some of the complications, and then hopefully do a little bit of a segue into some of the management. I'm not going to be talking about any of the medications today. They are constantly changing, and there's a ton of research being done in this area. And I'm also a physiotherapist. I'm not a physician, and so I can't really speak to a ton of the medications, or I'm not going to speak to them well. And so I'm going to leave that to the experts, so the pharmacists and the physicians that are working in diabetes care, practical nurses too. Okay, so when I was looking at some of the statistics, in America, the US, there's 29.1 million Americans living with diabetes. This is almost 10% of the population. That was a staggering number to me. When I looked at the Canadian statistics, it was even more staggering. There's 11 million people, or almost 30% of the population in Canada. 1 in 3 is living with diabetes. And that is a crazy number because of some of the soliloquy of events that can happen if our blood sugar goes uncontrolled. And we're going to talk about that a little bit more as we go through this podcast. And one of the crazy things is that the prevalence of diabetes has gone up 72% based on statistics from the Canadian Diabetes Association over the last 10 years. And prevalence is expected to go up another 41% in the next 10 years to come. So that statistic was from 2016. So they're expecting a 41% increase from 11 million over the next decade. That being said, this is a huge issue and something that many of our loved ones are going to be affected by. And therefore, I think we need to know about diabetes, how to manage it, how to catch it, if it might be us, and so that we can get everything properly medically managed and some of our lifestyle changes put into place so that none of the complications happen. When we talk about diabetes, there's 4 main groups, though there are a couple of extra terms that are coming into play over the last couple of years. I can touch on them briefly, but I wanted to focus on the main 4. The first one being PreDiabetes or borderline diabetes. And 50% of people who are diagnosed with PreDiabetes go on to develop type 2 diabetes down the road. And people think that because they're borderline, that they're not going to have some of the complications. But that actually isn't true. And you can start to develop some of the complications from abnormal blood sugar levels, even in a borderline diabetes state. So basically, this is a person who is above normal, but is just under the threshold for developing type 2 diabetes. And then type 2 diabetes is once you have a blood sugar level over 7 millimoles per liter through a blood glucose test. And that is kind of the threshold for being diagnosed with type 2 diabetes. The thing that we want to talk about with prediabetes is that often lifestyle modifications, so increasing level of activity, quitting smoking, getting onto a better diet, speaking with a nutritionist or registered dietitian about changes to be made in your diet to help control your blood sugar, can reverse borderline diabetes. It gets more difficult once you have been diagnosed with type 2 diabetes, though lifestyle-related interventions, so diet, exercise, stress, smoking, can have a huge impact on how easy it is for you to control your blood sugar with or without the combination or help of different medications, and can really affect the development or create a lack of development of the different complications that we see in persons who have diabetes. The other type, so we've gone through borderline or prediabetes, type 2 diabetes, which is the one that's more commonly diagnosed in adults. We have type 1 diabetes, which is what a lot of individuals are born with. And we'll go over the difference between type 1 diabetes and type 2 diabetes. Type 1 diabetes is a genetic condition, and it's an autoimmune disorder. What that means is that our body is attacking the cells, thinking that it's some sort of invader, and it's attacking our beta cells in our pancreas. And so our body is unable to produce insulin. When our body can't produce insulin, it can't take the sugar out of the blood and bring it into the cells, because that's what we need insulin for. Therefore, people who have type 1 diabetes need to be on medications for their entire life, because they're going to need to have that synthetic insulin pumping into their bloodstream because their bodies can't produce it. This is different from a type 2 diabetes, which tends to develop in adulthood, but we've seen now with poor diet that people are being diagnosed with diabetes younger and younger. And that to me is a really big concern as well, is that there's kids who are 12 and 13 being diagnosed with type 2 diabetes. Eek! But that's a whole other discussion. So with people with type 2 diabetes, what's happening is that the body is now no longer responding to the blood sugar in the body. And so you're becoming you're having an insulin sensitivity, and all of a sudden your body kind of can't keep up with the demands. And then it eventually has a blunted response to the blood sugar, because it's just been so elevated for so long that essentially your body can't meet the demands that you're asking it to. I talk about this in rehab all the time. I say your body needs to be strong enough to handle what you're asking it to do. And if it's not, then it breaks down. It's kind of the same thing where your body has to meet the demand of the blood sugar in your bloodstream. And eventually, if you're putting in too much high sugar states over periods of time, your body just can't keep up and you start to break down. And that's essentially what happens in prediabetes and in type 2 diabetes, just to different extents along that continuum. Depending on how long you've been affected and what kind of your story and your medical history is, that'll change the medical management. Again, I'm not going into the drugs, but sometimes they will do kind of like a metformin or a medication that helps your body amp up its insulin production. But you eventually get to a point where you're going to have to start injecting insulin if your blood sugar maintains a high level over time and your body just can't keep up. Okay, so we talked about borderline diabetes, type 1 diabetes, type 2 diabetes. The fourth one we're just going to touch on briefly is gestational diabetes. And what happens with 2 to 4% of pregnancies is that they develop a transient diabetes during the course of their pregnancy. And they think that this is because of the different hormone fluxes that people are experiencing as they go through each of their trimesters in their pregnancy. Women who have gestational diabetes are more likely to to have type 2 diabetes later on in life. And so it is a risk factor for diabetes down the road. It's just usually managed during the time of your pregnancy. And then after delivery, your blood sugar levels tend to stabilize, at least for the time being. But if you are diagnosed with gestational diabetes, you have to know that you are at risk for diabetes down the road. And so you want to make sure that you're taking the necessary steps to prevent that from happening. Okay, so if 1 in 3 Canadians, or just under 1 in 3 Canadians, are experiencing diabetes, I think it's important for us to know the signs and symptoms and how it's diagnosed. Some of the signs and symptoms of diabetes, and if you're going into higher low blood sugar, which is something different, but signs and symptoms are an unusual amount of thirst, frequent urination, having to go to the bathroom all the time, a weight change, either weight gain or weight loss, an extreme fatigue or lack of energy, blurred vision, frequent infections, delayed healing, and numbness or tingling coming into the hands or feet. If you are experiencing any of these symptoms, it may be a result of abnormal blood sugars, especially if diabetes runs in your family. Getting this checked is going to be really important. And the way that we check our blood sugar to see if we do have diabetes there's a couple of ways. They'll do an oral glucose tolerance test, which means that you take a big swig of sugar and they measure how your body responds and what your blood sugar levels go up to. If they start spiking, then your body is not able to handle the increased level of blood sugar. So your insulin levels aren't coming in to respond. And that's indicative of a diabetes. The other big one that they do is called an HbA1c level. What this is the amount of sugar that is attached to the cells in your blood. So HB stands for hemoglobin, which is your red blood cells. And if sugar is elevated in your blood for long periods of time, it actually starts to attach onto those cells. If it's been like that for long periods of time, the level of HbA1c, which is a glucose-attached red blood cell, will go higher. Your red blood cells turn over, or what that means is the lifespan of a red blood cell is 3 months before your body will break it down and build new ones. And so the HbA1c level is kind of like a report card. The higher your HbA1c level is, the higher your blood sugar has been on a consistent basis over the last 3 months. It's kind of that, as I said, that report card to really check how you've been doing over as a trend versus the oral glucose tolerance test, which is a snapshot in time. And both of these tests have validity, and both of them are used commonly by your physician who will be following you for tracking some of your diabetes. And knowing what those are and what those numbers mean is going to be really important. Okay, so we talked about the different types of diabetes, what kind of happens with diabetes being that your body isn't able to respond to the blood sugar. It isn't able to bring it into the cells. And so it stays elevated in the bloodstream, which can cause all sorts of havoc. We started talking about the different types of testing for diabetes. And the other thing that I wanted to go into was some of the complications. And I think that this is one of the most important, I would say that. One of the most important reasons, as I'm discussing this with myself, of why we need to manage our diabetes. Because when people are diagnosed with diabetes, life expectancy can drop 5 to 15 years. And that is a result of the issues that having high blood sugar causes throughout the entire body. Our body is meant to have blood sugar at a certain level. Once it's elevated, that sugar can actually become very destructive to some of the tissues around our body. I think that's why we've been getting into the whole sugar is toxic type of thinking when it comes to diet, especially around processed foods and refined sugars. And it's because of the effect that high blood sugar can have. And so let's go through a couple of them. The apathies are the common ones that we talk about when we have persons in the clinic that have been diagnosed with diabetes. So retinopathy, nephropathy, and neuropathy are the big three. These are damage to the retina or the eye, some of the issues in the eye, damage to the kidney. The nephron is a small area in the kidney, and damage to some of the small nerves, especially in the hands and feet, causing some of the numbness and tingling. Elevated blood sugar can actually cause microtrauma to the outside portions of these cells in the eyes, the kidney, and in the nerves in particular. Because they're smaller, they're more susceptible to this damage. And so we can see people who have issues with their vision. So eye damage can be the diabetic retinopathy, can cause issues with the kidney, cause damage to the kidney, which can eventually result in chronic kidney disease requiring dialysis. And if anyone knows anyone who's been on dialysis, it's 4 hours a day, 3 times a week, where you're stuck in a chair flushing out your kidneys because your kidneys aren't able to function properly. And a lot of people who have chronic kidney disease also have diabetes. The last one is neuropathy. So that is affecting the nerves coming into the hands and feet because they're the smallest. And so many people with diabetes actually don't have sensation in the bottom parts of their feet, or they can get neuropathic pain as a result of this damage. So instead of having a muscular pain, it's actually a nerve pain, which tends to be more of a burning sensation or a stinging at the bottom of the feet. And that can cause a lot of issues with the feet. Another thing that a lot of people with diabetes need to be careful of is infections or breakdown of the skin in the feet. Part of it is because of this neuropathy. So because there is injury to those nerves, often our pain signals aren't the same now in the bottom of our feet. If we develop a cut, or that can lead to an infection because we're more at risk for infections with diabetes, it can develop into a pretty nasty wound at the bottom of our feet. If we don't have the same pain sensation because pain is traveled up through the nerve, then we can develop a lot of persistent wounds on the bottom of our feet. And so that's why wound care is a big priority in people who have been diagnosed with type 2 diabetes. And often people who are diabetic are followed by a podorthist or a chiropodist to make sure that their feet are well taken care of. Okay, so those are kind of the physical manifestations of diabetes, some of the complications. Another one that I thought was really interesting is anxiety and depression. It speaks to the effect of high blood sugar on the brain. Glucose can pass the blood-brain barrier and is one of the main sources of energy in the brain. And so if it isn't being regulated, then it can actually affect our emotions. And people with diabetes are at increased risk for different mental health conditions, including anxiety and depression. And so that is another reason why we need to be very careful with the level of our blood sugars over time, because it can really affect not only us physically, but also mentally and emotionally. And I think that can have huge implications down the road. Okay, the next one, and it's another big one, is heart disease and stroke. People who have diabetes can develop heart disease, which we've talked about in a previous episode, and I'll link to that in the show notes, and stroke 10 to 15 years earlier than somebody without diabetes. That is huge because the impacts of having a heart attack or a stroke are also ginormous. So if we have diabetes and now we slap on issue with our heart or the blood vessels around our brain, we can be in big trouble. That's why as soon as people are diagnosed with diabetes, they tend to be put on blood pressure and cholesterol medications, just because the link between diabetes and heart health is so strong that they almost need to be treated in tandem, which can mean that as soon as you get a diagnosis of diabetes, you feel like you get pumped into all of these medications. But it's really, really important because the sugar that is elevated in your bloodstream goes throughout your body, which includes the vessels that are around your heart and around your brain. And if diabetes is contributing to more plaque formation, then we can be at increased risk of heart attack, increased risk of stroke, increased risk of peripheral vascular disease. There it is, PVD. And that can cause blood clots in the legs. And so we need to be very concerned about our blood flow and making sure that our heart and our brain and all of the tissues around our body stays healthy. The Canadian Diabetes Association and the American Association of Diabetes have kind of outlined this management strategy for people with diabetes. And I kind of like it because it's easy to remember. It's the ABCDEs. And so I'm going to go over them really briefly. I feel like this can be a whole other episode, but we're going to try and truncate everything. So A is your A1C level. So this acronym is how to manage diabetes. What are the things that we should be paying attention to when we're diagnosed with diabetes to make sure that these complications that we just talked about don't develop? So A is A1C. That's our blood sugar report card, making sure that our trend over time is not in a high blood sugar state, that we're keeping it into normal values. B is blood pressure. We want to try and keep our blood pressure under 130 for people who are diagnosed with type 1 or type 2 diabetes. Keeping our blood pressure under control not only helps with the symptoms of diabetes, but also makes sure that our heart and our brain stay healthy. It's a big risk factor for heart disease and stroke. C is cholesterol. Again, we're talking about heart health and making sure that our healthy cholesterol is high and our unhealthy cholesterol is low is going to be really important and something that your doctor is going to be looking for. And this can be managed through not only healthy lifestyle, but D is drugs. So making sure that your medications, that you're taking them. I have some of my clients who don't like taking them, and that is a risk that they are taking. And we can only talk about the advice of the physician and the advice of your doctor, but you need to make sure that, you're being medically managed appropriately. And that could mean that you're on different diabetes medications until you find the right one for you. Same thing with blood pressure and cholesterol. And if you get yourself moving and you get onto a healthy diet and all of a sudden your blood pressure and cholesterol come down, then maybe you don't need them as much. But in the meantime, making sure that you're on those medications that your doctor prescribes and on them appropriately. E is exercise. This one's obviously my favorite as a physio and a gym owner and a PhD that's in exercise. This is the key to me. So blood sugar can be managed more effectively with cardio and resistance exercise because we're increasing our body's demand for sugar. And so we're taking in more because our muscles are moving, our heart is pumping, and we're burning more energy. So we need that sugar. And when there's an increased demand, our body takes in more. And a lot of people can see really positive results for managing their blood sugar when they're exercising daily. I know we try and work out 4 to 5 times a week, but it's actually recommended that for people with diabetes, they try and get moving 7 days a week, even if it's just going for a walk on a couple of those days, because of how effective exercise can be in taking in more sugar into the tissues of our body. Okay, and then the last one, A, B, C, D, E's, is the S, and that is smoking and stress. Again, 2 lifestyle modifications that we need to try and incorporate if we've been diagnosed with diabetes. Smoking and diabetes can work synergistically and affect a lot of the tissues around our heart and our lungs. And we don't want that additive effect to happen. And stress, we're seeing more and more the negative impacts of stress on our health. And we're just less resilient when we're overly stressed out, or we tend to go into worse habits too if we're stressing out more throughout the day. And therefore, it's really included in not only our management plan for heart disease and stroke, but also in our management plan for managing our diabetes. If you've been diagnosed with type 2 diabetes, talking to a registered dietitian about what to do with your diet, there's a lot of information on the internet, and sometimes it can be really confusing. I know I find it confusing, and it seems like every week there's something different. So talking to a registered health professional can give you the ins and outs or give you a starting point, because it's hard to change your diet, and sometimes the accountability can really give you positive results because it's a lifestyle change, right? It's not a 6-week change. It's a 6-year, 60-year change. And so you have to do potentially baby steps, or you have to make sure you find a plan that's going to work for you, not just what so-and-so on the internet said. And I'm always an advocate for that. Yeah, but exercise and particularly diet is going to be huge in managing your diabetes, whether it's type 1, type 2, gestational, borderline, whatever. And a little bit of a blimp into the other types that we're trying to see. We're seeing that some people have characteristics of type 1 and type 2 diabetes, which is really interesting. And then there's also some original talk about some of the Alzheimer's and dementia pathologies being related to dysregulations in blood sugar. So I think we're going to see a little bit more about the impacts of sugar on different areas of health and different chronic conditions. And I guess we're going to have to see what those research studies come out to be in the next couple of years. But I thought that was super interesting. And if that is the case, then we have a lot more research to do and a lot more to find out. All right. That is our podcast for today. I hope that was helpful in explaining some of the mechanisms and some of the things that happen when we're given a diagnosis of diabetes. Reach out to some of your associations, reach out to some of your healthcare providers if this is you, because it's a big change and you want to make sure that you're getting on top of some of those blood sugar levels to make sure that none of those complications happen. And it can be scary. Like, you're on medications now and with no end in sight and all that kind of thing. So If you have any questions, make sure you email us at info@staveoff.ca. If I don't have the answers, I'll try and find the answers for you. In the show notes, I'll link to an article that I wrote on diabetes as well. So if you want a little bit more reading, and there's some links in there to some of the associations. Otherwise, have an awesome week, and we will see you next week. And hopefully I'm a little bit less nasally. Bye, guys.
Thank you for listening to the Stave Off podcast. Go to staveoff.ca to check out the show notes and more helpful content and how you can lead a long and happy life. This podcast is brought to you in partnership with the Senior Rehab Project at seniorrehabproject.com.